Are you ready for this? So, just when you thought we were kind of getting away, we were kind of getting back to some sort of normalcy, whatever we're in right now, um, this came about. So, Wide Awake Media says, speaking at the WEF, banker Peter Sands excitingly announced the arrival of a biannual short-acting, 100% effective vaccine. Uh, just that phrase alone is just an absolute disaster. Biannual, short acting, but yet 100% effective. It works, but you have to take it biannually, and it only works for a short amount of time. But it works. You'll take it every 6 months, and it's incredibly effective. Will you be lining up to take that? So here's him at the WEF making the statement that, hey, guess what? Biannual jabs are coming.
Looking forward, there's just a profusion of really exciting technologies across all three diseases. The one that is probably the most exciting is the emergence of long-acting injectable PrEP. It's a bit of a mouthful. Effectively what it is, if you're looking at it from a patient perspective as opposed to a scientific perspective, is it's functionally equivalent to a short-acting, 100% effective vaccine. You take it every 6 months. This is a drug called the lenacapavir, and it is incredibly effective.
It's incredibly effective. Incredibly effective. It's so powerful, but yet you have to take it every 6 months. And they don't even say what the vaccine is for. That's kind of odd. That's eerie. That's sinister. Oh, we got this vaccine that we're going to release out, and it's going to be biannual that people can take every 6 months, and it's so effective. It's so wonderful. Well, what's it for? What vaccine is this? But I can tell you they're very safe and effective, according to the YouTube scientists and guidance at Google. And in regards to that, the reason I show you that is because this news came out. So RFK Jr., the Secretary of Health and Human Services in the United States, just announced that he wants placebo testing for new vaccines. Some experts say it's unethical. It's unethical. It's unethical. Come on. How else are we going to get billions of dollars treating our people like lab rats if we have to do testing? Testing. This isn't like a new car where we have to get dummies. This is just a vaccine that could affect your internal organs and your health and your lifestyle. What do you mean we have to do testing? So this is from Global News. It says the U.S. Health Department, under the guidance of the Health Secretary, Robert F. Kennedy Jr., says it intends to add the requirement of a placebo testing phase in vaccine trials to provide more transparency about medical products. But experts warn the process could threaten immunization access and create public mistrust in the efficiency and the validity. That's how I'm saying it because it's funnier. Of inclusions. So it's going to misinform the public if we provide information to the public. That's what the experts are saying. That's what the trust the science experts are saying. If we inform the public and provide testing to prove the efficacy of this drug, this pharmaceutical concoction, that's going to mistrust the public. That's going to mislead the public. As opposed to scaring people, as opposed to mandating people, as opposed to, hey, get this jab or you're going to be fired. And censoring people and firing doctors and firing clinicians and physicians and nurses that have a counter opinion. In a statement to the Washington Post this week, a spokesperson for the Department of Health and Human Services said that all new vaccines will undergo safety testing in placebo-controlled trials prior to licensure. a radical departure from past practices. Fast tracking, turning us into guinea pigs, using Operation Warp Speed, which that was under Donald Trump. And Donald Trump congratulated Anthony Fauci in his first term. But at least Donald Trump restrict security clearance for the guy. But Joe Biden pardoned him for over a decade. Why would it be over a decade, this pardon? Well, because Tony Fauci, Tony the Science, lied to you. Lied to you about COVID, lied to you about the origin, lied to you about masks, lied to you about every single point and turn, and also lied to you about his business dealings with gain of function. And as I'm saying this now, reading you this article, it has now been announced, and I wish I had the video to show it, we'll probably show it on Wednesday, that Donald Trump is making an executive order to ban gain of function research. Something that should have been already banned because of how horrendous and anti-human and decimating against humanity it is. Because gain of function research has created a lot of these crises, has created just this nefarious bioweapon against people, which is also now confirming that COVID and the coronavirus was intended as a bioweapon, created and manufactured in partnership with EcoHealth Alliance and the NIH and all these big top pharmaceutical agencies, alongside with the Pentagon, alongside with DARPA. Why would DARPA and the Pentagon be colluding with pharmaceuticals to build bioweapons, to go after their enemies? And they tested that on you. And here we are in 2025, and yet there's still people congratulating Fauci, listening to these so-called experts, being okay by being lied to this entire time. There's still people out there that are wearing masks in their car, alone. If implemented, the new regulations would require some test subjects to receive vaccine doses, while others would be injected with a non-reactive substance. Vaccines that target new infectious agents are often tested using the placebo method, but for well-known and researched diseases, health experts say using a placebo poses ethical issues because the group receiving it will not know if they're actually protected against the illness. Well, that's why you do the study. You publish all the findings, and you build upon that. That is how science works. You have a hypothesis, you do some analysis, you do some data collecting, you try out some trials. If that doesn't work, you go back to the drawing board, you do another trial until you come to a conclusion. That is how science operates. That is the process of how everything in the scientific community with medicine and technology and innovation has always been. Always been. Until recently, when big pharmaceutical gangbangers decide, hey, we're going to change the rules for science. Where instead of doing testing, instead of rolling out documents to prove the efficacy of the vaccines, we're just going to manufacture consent and propagandize and buy out the news markets to lie to you. Saying that if you don't get this, you're killing grandma. If you don't get this, you're going to lose your job. If you don't get this, you don't travel, you don't get to go out with your friends, you don't get to go outside, enjoy sunshine, vitamin D, vitamin C. That ivermectin is horse paste, that hydroxychloroquine is a pool cleaner. They manufactured consent instead of actually going through scientific analysis, which proves those experts aren't scientists. The health department did not provide details on how the proposed changes will be enforced or to which vaccine trials they will apply. It also did not define what is meant by new vaccine, though it said the policy would include the flu shot, which is updated yearly. And there's a study that just came out that the flu shot isn't actually as effective as people may think. That the flu shot is actually uh, causing people to get influenza, not preventing it. Did you know that? Go figure. Health experts have argued that the updated COVID-19 vaccines may be included, which they say could delay access. Oh no! That means my yacht purchases, my private islands, my $200 billion that Bill Gates cashed out right before he changed his mind about vaccines might be delayed. Oh, poor thing. We might have to actually do some testing. We might actually have to prove to the general audience that our scientific analysis is correct or not. Oh my God, we might have to come to conclusions. Peter Lurie, a former Food and Drug Administration official, told the BBC it's hard to tell exactly what is being processed. Again, they just told you. They're going to do placebo testing, which is something that pharmaceuticals and immunization has been doing beforehand, before the takeover of big pharmaceuticals, before Pfizer, Moderna, AstraZeneca, Johnson & Johnson formed this alliance, this gangbanger, to screw over you. They used to do this. They used to do this in medicine until big pharmaceuticals got so powerful, so corrupted, so overwhelming that they just bought out the science. And now you're getting advice from Bill Gates. Bill Gates, the college dropout. Bill Gates, who can't even program his own computers, for God's sakes. That doesn't think trees are efficient enough to deal with climate change. Trees, the thing that take carbon away and provide oxygen. Trees are worthless, according to him. But he's good enough to talk about medicine, apparently. An HHS spokesperson also told the BBC that Kenny's goal is to achieve radical transparency, which means being honest and straightforward about what we know and what we don't know about medical products, including vaccines. Exactly! Transparency. And if they're telling people that their pharmaceuticals are safe and effective and there's no need to do this, then why not prove it? Why not prove how effective they are? If that guy at the WEF says it's so effective, why do we need it every 6 months? Prove the science to me. I'm interested. I want to listen. I want to hear more about this. So you got to prove it to me. Prove it to me with science. Prove it to me with transparency. The statement went on to claim that none of the vaccines recommended for children in the United States, except the COVID-19 shot, had gone through placebo testing, which the health department says leaves it knowing very little about the actual risk profiles of these products. However, health experts warn that the statement is misleading because vaccines administered to children, including for hepatitis A, B, and polio and mumps, were all tested against placebo during their development stages. But it's kind of funny. It's kind of funny now, being a grown adult, reading about this and reading more into medical sciences and hearing from people like Dr. Pierre Corey, from people like Dr. Peter McCullough, Dr. Robert Malone, and RFK, and so many other people. Isn't it kind of weird that hepatitis A and B, is given to young children where the infection originates from sexual activity? Don't you think giving it to a young kid who hasn't gone through puberty, who is barely able to walk on their own, is not a full functioning child yet, is a little much? Don't you think it's a little too much? I know I'm going to sound like Jenny McCarthy. I know that's going to scare people. Oh my God, you're going to sound like that, hypocrite on television. But she was kind of on point with this. Why are we getting hepatitis A and B to a young child for an infection that comes from sexual activity? It doesn't make sense. The BBC adds that all new immunizations go through a type of random testing where one test group receives the vaccine and the other is given a placebo. But in the new system proposed by HHS, experts say vaccine under testing may not undergo the same randomization process because it is unethical to withhold an injection that is known to be safe from a particular group, and because shots that are updated yearly go through minimal alterations. For example, the COVID-19 vaccine has endured scrupulous testing over the years. So this is global news. Just to remind people, this is global news now chiming in to cover up this, because global news gets funding from big pharmaceuticals. Same with a lot of Canadian media, same with the U.S. media. So they still have to contradict RFK, even though RFK, all he's trying to do is bring transparency to the table, bring transparency to you, because as it goes, that you as a patient get the final say. Doctors can recommend different treatments. They can recommend whatever they prescribe to you, but you as a patient get the ultimate say. And what RFK Jr. is saying is that in the medical science world, they have to prove to you, they have to bring you the evidence to prove how effective it is so that you as a patient can decide whether to get injected or not. He's not taking away the vaccines. Not taking away, he's not increasing measles and polio and whether crap that MSNBC and the mainstream media are trying to pull out their ass. He's saying that he's going to bring transparency, which is amazing. Amazing. And it's amazing that this is coming from the United States, and not a single word of this comes from Canada. They won't even hold Theresa Tam accountable for her actions. None of the politicians. Because they're all bought. They're all bought by big pharmaceuticals. So this is the global news aspect of this. For example, the COVID-19 vaccine has endured scrupulous testing over the years. They haven't. They've admitted to this, that they bypassed testing because they need they wanted to bypass that so they can get the rollout through the emergency authorization, so they can get the most money. They don't care. They never did care. They just wanted to roll it out as a quick fix to a virus we were not allowed to talk about, want people to get jabbed, and now these people, because of adverse side effects, are continuing to rise. Now they feel like, oh, now we got to maybe correct our wrongs. Now maybe we got to release some data. Now we got to, bring attention to this problem. And all that is necessary to update for a different Omicron variant, and that one you used prior to Paul Offit, director of the Vaccine Education Center, Children's Hospital in Philadelphia, told the BBC. Nonetheless, an HHS spokesperson said that significant updates to existing vaccines could be seen as new products, which could necessitate additional trials. So here is RFK Jr. This was on CBS this morning. Or I guess they call it CBS Mornings, whatever the show is. With one of their anchors. And here's RFK Jr. Again, just trying to bring transparency to the picture. Just bringing out transparency. And watch how this anchor tries to smack him down. Because this anchor is protecting the pharmaceutical industry. The pharmaceutical industry that pays advertising to CBS, to all these major outlets that keep them afloat. Watch this.
I've always said during my campaign and every public statement I've made, I'm not going to take people's vaccines away from them. Right. What I'm going to do is make sure that we have good science so that people can make an informed choice. And we are doing that science today so that we know the risks of that product, and we also know what the benefits are. And right now, we don't know the risks of many of these products because they're not safety tested.
And I understand that position, but just to be clear, you are saying, and we do on the federal level, and you personally do recommend that people get the measles vaccine.
And when I say they're not safety tested, what I mean is they're not adequately. Many of the vaccines.
So you can see RFK Jr. laid out a statement. We're just trying to bring good science to the process. We're trying to bring transparency. And the guy chimes in and says, yeah, I understand that, but you're going to still get people to get injected for the measles, right? You still got to serve the big pharmaceutical gang, right? You're not gonna go full radical and start talking about diet, start talking about exercise, start talking about vitamin C and vitamin D. You're not gonna go that crazy. You're not gonna talk about ivermectin, the award-winning pharmaceutical that's able to be created so cheaply that other countries could be doing this, and that won a Nobel Prize, that they were using ivermectin as a treatment for cancer. But no, you're not going to go full radical, right? You're not going to go full radical, because then we have to cut this interview. So the anchor is making cover for the corruption, the big pharmaceutical corruption. And even as simple as bringing transparency, just informing the general public, is so dangerous to this pharmaceutical gang. Because if they don't capture you, if they don't manipulate you, if they don't censor you, if they don't brainwash you, then if word gets out, they become less powerful. They become less powerful, which means the media becomes less powerful. And that whole business practice loses its momentum. That's why they need a schmuck like him interviewing RFK to go, whoa. I get what you're saying. Transparency. Yeah. You're still going to get people injected, right? And here's this. RFK Jr. will order placebo testing for new vaccines. Alarming. Health experts. This is from the Washington Post. Alarming. It's alarming to inform your patients about what they're injecting in their body. How dare you? How dare you bring transparency to perspective? How dare you? Don't you know information kills? Information is like the new virus. Next thing you know, people get infected with all these words and sayings, and then they go on the streets and talk about natural immunity and go into this conspiracy route. How? Alarming. Alarming to health experts. Like, Dr. Peter Hotez, the bow tie wearing idiots that's supposed to be a health advisor, and yet eats cheeseburgers 4 times a day. He's a health expert, all right, compared to RFK Jr., who looks that good at 70. Just saying, that's pretty impressive. So here, this is another clip here. This is RFK Jr. on Patrick Bet-David's Valuetainment. And again, all he's stating is brain transparency, and here's him describing this as a win for the American public.
So not a single one of the vaccines, the 72 vaccines now administered to our children, have ever been tested against a placebo. And I, in fact, sued HHS in 2016 and said, show me any placebo studies that you have for any vaccines. And they were unable to do so. None of them have been tested. And you don't have to sue them like I did. Anybody can go on their cell phone and look up manufacturer's insert, hepatitis B vaccine, Gardasil vaccine, polio vaccine. Do you know how many days the current polio vaccine, do you know how many days it was safety tested for, Alan? 48 hours.
So this is where it debunks all the rhetoric of people say, RFK Jr. doesn't know what he's talking about. He's a conspiracy nut. Where is he getting this data? RFK Jr. is telling you to do your own research. You know that thing that people were scared not to? Don't do your own research. I heard people on stage stating this. I heard people on TV saying this. Don't do your own research. Funny how we can't do our own research in 2020. Even though we're in the highlight of the information age, everything is more accessible thanks to the internet. But we need to censor more of it because we don't want people to get the wrong idea or become conspiracy theorists. I wonder why that is.
The hepatitis B vaccine, the Glaxo version, was 4 days. The Merck version, 5 days. That means that if the baby they gave that to had a seizure on day 6, it never happened. If the baby died on day 6, it never happened. If the baby got food allergies that were diagnosed 2 years later, it never happened. If the baby got autism, which is not diagnosed till 4 years of age, 4.2 years of age, it never happened. Autoimmune diseases, you cannot see those if you have these short-term studies, and you can't see any risk if you don't test against a placebo. And my question is, nobody knows, because of that, nobody knows the risk profile for any vaccine that is currently on the schedule. And that means nobody can say with any scientific certainty that that vaccine is averting more injuries and deaths than it's causing. And my question is, how in the heck can we be mandating to children that they take a medical product for which we do not know the risks? And to me, that is criminal.
How the hell are we being mandated without the information? Well, otherwise it'd be anti-Semitic. Oh, sorry, that's RFK Jr.'s other position. That's not conflating the two, but you get the picture. Yeah, and there's things I can criticize about RFK Jr. as a person, but he's on the right track about this. He was one of the best environmental lawyers in the country, had a successful career. Barack Obama was about to endorse him and be part of his administration back in the day because of how well he was in the environmental sector when he cleaned up the Hudson River, when he was protesting against pollution into water streams and wetlands. He had a successful career. Everybody adored him, right up to the point that RFK Jr. started to mess with the big boys at the pharmaceutical industry. That's when shit hit the fan. RFK Jr. got this huge amount of pressure, shit thrown at him from the mainstream establishment, brought to you by big pharmaceuticals, and he was exiled at the Democratic Party, exiled to an independency, lined up with Donald Trump because Donald Trump also got exiled by the Democratic Party. Now he's in the administrative control. I give credit to this, but I also can also criticize RFK Jr.'s positions on things like Israel. So I give credit to this. Thank God for this. And like I said, it's amazing that in the United States, at least I could say with full certainty that at least in the United States, they're attempting to fix their wrongs. They're attempting to inform the general public. Anthony Fauci, all the congressional trials with him and Rand Paul, that's at least something. I know that they're not going to criminally prosecute him, one, because he got that stupid pardon from Joe Biden, and two, Republican or Democrats, they're all bought by the big pharmaceuticals. They're not going to touch an inch of Anthony Fauci whatsoever. A guy who's made multi-million dollars making bioweapons. They're not going to touch him with an inch. But at least it informs the general public. What are we doing here in Canada? Nothing. We have not done a single thing. We know Theresa Tam, our health minister here in Canada, has also lied, has gaslit people, has done these extraordinary. We didn't prosecute Chrystia Freeland. We're not angry at Justin Trudeau anymore. So what are we doing here in Canada? What are we doing in Canada to fix the wrongs? And I know friends of mine that I bring attention to this, and they immediately come at me by saying, Jason, why do you still talk about COVID? COVID was a long time ago. COVID's over. I say because the last couple of years going into 2020 was an absolute roller coaster. And the reason I keep talking about this is because people still feel the burden. People are still struggling because of it. There's people like Kayla Pollock in Bradford, West Gwillimbury, here in Ontario, that got paralyzed by the mandates. What happened with the Freedom Convoy? There's a lot of factors that went into the horrendousness of this mandate, the horrendousness of this pandemic, that we're learning more and more information. So no, I'm not just going to cover under the rug, pretend to sugarcoat it, and things are okay. Because of how destructive it was to our country, to society as a whole, to humanity, to all the businesses that lost because they shut down small businesses but kept Amazon and Walmart and Loblaws open because that was apparently safe. All the shit that we went through. I'm not just going to let that go. I'm not going to let that go. I'm going to bring attention to that so that people are aware about this and they can do the right thing. So thank God RFK Jr. got his head on straight for this. And people that are against this, people that want to criticize transparency, well, congratulations. You're either bought by the pharmaceuticals, you're either a shill for them, or you're a dupe. You're a dupe idiot. Because why would you be against transparency? Why would you be against informing the public on whether or not these medical concoctions are safe and effective? Why are you against that? And no one has an answer for that. But they're being told to hate RFK Jr. because the TV told them to. The TV brought to you by pharmaceuticals.